Now I invite Dr. Sunil Choudhary, Director, Institute of Aesthetic and Reconstructive Surgery, Max Healthcare, to present his talk. Let's have a look on the future of restorative plastic surgery. Dr. Choudhary, please.
Thank you. Thank you, Debjani. Let me just get my talk out. Hey, can everybody hear me? Well, I can't hear you. Can everybody hear me? Good. Ladies and gentlemen, I once again extend a hearty welcome to all the delegates, and it is indeed a rare honor to stand here in this auditorium and give a presentation. I am a plastic surgeon, and I will show you a glimpse of the exciting cutting edge that we are already doing and also the future which is already close to us. So let me take you in this wonderful journey where surgical craft blends science with art and creates the unthinkable. My specialty is witnessing a paradigm shift in thinking, where the line between imagination and reality is disappearing fast. Laparoscopic surgery is everywhere, but it requires a cavity like abdomen or thoracic. Plastic surgeon for a long time never adopted it because they needed a cavity to actually put an endoscope. But now we believe the cave you fear to enter holds the treasure you seek. An endoscopic assisted surgery of the face is fast changing the face of facial rejuvenation. A small 4mm endoscope inserted through a single port in the scalp can allow insertion of sutures subperiostally to lift the entire mid-face. The result of one such case, I will show you next, will amaze you. This 51-year-old lady underwent an endoscopic mid-face lift through hidden scalp incisions, and look what a transformation has been achieved. Natural and youthful face without any scars. This is like a dream come true for her. Just concentrate on the words around this yin and yang circle of life. I want all of you to see this. This is really amazing. If you read this clockwise, you can read dark, 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 dark. But what happens when we do it the other way around? Perhaps all of you have missed the untapped words in the same circle, just now reads the same words in the clockwise fashion, and it becomes light, light, light. Fascinating, isn't it? So friends, untapped potential is the difference between where the person is now and where he or she can be. I'm sure none of you thought that ultrasound that we so closely know of is capable of melting fat in the body. Well, it is, and here you can see how VASER, which is essentially ultrasonic liposuction, selectively melts and emulsifies fat, which can be taken out through fine liposuction cannulas. VASER has taken the art of liposuction to a different dimension, with capability to contour body like never before, and that too in the safest and most selective way possible. This is pure fat, aspirated after ultrasonic liposuction of VASER. As you can see, there is very little blood in it. A patient like this, she had big love handles, literally melted away with VASER liposelection, as you can see here. Someone once told me that when love is hidden within hate, it needs to be relooked. Again, look at this picture very closely. You can all see the dark letters which spell out hate, but what you may have missed is love, written inside the same letters in the light pink shade. Love hidden inside hate. I used to hate implants made of silicone for the rhinoplasty patients, or the nose job, as we call it in the common language. Implants had a high rate of extrusion and infection, but then now we're discovering a new material, which is an absorbable implant. As William Shakespeare said, love asks me no questions and gives me endless support. So we now have an implant which gives support when most required, but gets absorbed slowly, thus avoiding all the late complications we used to see with the silicone implant inserted into the nose. So finally, I have an implant I love. This is a case of an unfortunate young man suffering with a collapsed septum resulting in a saddle nose. This was due to previous overzealous surgery done elsewhere. In order to reconstruct the nose, which had no skeletal support, we took his rib cartilage, carved it out into an anatomical septal graft, but the problem was how to keep it in place in a nose which lacked any skeletal support. This is where our absorbable implant PDS plate, a true friend of a rhinoplasty surgeon, comes handy. The PDS plate is first positioned in the nose, and the rib cartilage is then bolstered to this pillar, as you can see here, to serve as a stable scaffold. And a new septum, as you can see, is formed to actually form a skeletal support for the nose. What we were able to achieve for this young man with such a bad collapsed nose was unbelievable. As you can see in these post-operative pictures, how nicely his nasal contours have been restored. Friends, freedom is every child's birthright. Brain must have freedom to grow and expand. Sophocles, the ancient Greek playwright, once said that even if my body is enslaved, still my mind is free. But friends, what would happen if your mind was enslaved and caged? Well, this is exactly what happens in a congenital condition called craniosynostosis. Look at this teardrop skull of a 3-year-old baby. The skull has stopped growing in the frontal part due to early bony fusion of the metopic suture. So the brain is growing, but the skull is not growing. This would eventually result in the strangulation of the brain and result in mental retardation. But the heroic radical techniques of craniofacial surgery allows us to take the entire skull cap out on the table, slice it, and rejig it to expand it, allowing the brain to expand once again and have its freedom, the child's birthright to freedom, the brain's birthright to freedom to expand and grow. Friends, do you know which specialty does this transplant pioneer belong to? Dr. Joseph Edward Murray was an American plastic surgeon who performed the first successful human kidney transplant on identical twins Richard and Ronald Herrick in 1954. Plastic surgeon, the father of organ transplantation, but the specialty slipped out of our hands soon after. Look at this reflection. Sometimes those who teach have to learn again. Teach and learn are the reflections of each other. And plastic surgeons are once again at the forefront of transplantation with the advent of face and hand transplantation. This is a hitherto unexplored entity, and as Martin Luther King rightly said, faith is taking the first step even when you don't see the entire staircase. We are used to routinely doing facial reconstruction with autologous transplantation within the person's same body with microsurgery. My unit itself does approximately 90 to 100 such cases in a year with a phenomenal success rate of close to 99%. Here you can see one such case where the entire right side of the mandible has been resected for advanced oral cancer, and the same is being reconstructed with customized free fibula flap harvested from the person's leg and transplanted to reconstruct the defect, restoring what you can see here, normal form and function. The fibula that we've reconstructed can even take dental implants, and the person's denture can also be restored. But face transplant is the real new paradigm of restorative surgery. We're excited, but still not entirely sure of what we are getting into. This is America's first face transplant case, a lady bitten by a dog. No lips, no nose. Once a suitable brain-dead donor is available, the segment of face is harvested from the donor and joined to the recipient with the help of microsurgery, restoring vascularity in the transplant. Patient has to be on lifelong immunosuppression. A 1-year post-operative result reveals something that was never possible with the traditional plastic surgery techniques. But the real question is, what happens if it fails? So friends, I will leave you with these final thoughts expressed by the first human face transplant team from France. The spirit of excellence is to take care more than others think is wise, to risk more than others think is real, and expect more than others think is possible. Thank you.
Thank you, Dr. Choudhary. It's amazing, isn't it? इतना सन्नाटा क्यों है भाई? ठोको थाली. Can I request Dr. Sanjay Sood to please come on the stage and present a moment to Dr. Choudhary, please?